Hi, Stephanie. Thanks for taking the time to speak with us.
Absolutely.
Are you ready to answer some questions?
Yes.
Let's get started. We'll start with your name
My name is Stephanie Gondek.
and what you do here at Benefis.
I am a certified registered nurse anesthetist.
And what kind of specialized training did you complete for your career?
My training included getting a bachelor's of science degree in nursing, and then after nursing school, I worked in a medical ICU for 2 years. And after that, I went back to complete my master's in nursing for nurse anesthesia, and that was at East Carolina University in Greenville, North Carolina.
And what led you to a career in medicine in the first place?
I had a really complicated medical history as a child, and so that required me to have lots of surgeries and deal with lots of anesthesia providers. And as I grew up and had more memories of the pre-op and post-op period, it was always the anesthesia providers that really stood out to me as making the biggest difference in my comfort level and how I felt and just how nervous I was. There was one CRNA in particular during one of my final surgeries that just made such an impact on me that I knew that that was what I wanted to do, even as a high school student.
And what's the most unique part of your job?
I would say the most unique part of my job is that I am a solitary practitioner. So being an anesthesia provider is a really independent kind of job. You're the only person in the room doing anesthesia. But what makes it really special is that we're always involved with a team. So whether it's doctors, nurses, techs, all kinds of different interdisciplinary people, we're always involved in a different team every day. And so it makes the solitary practice kind of feel like a little family.
And what do you wish your patients knew before their surgery or procedure?
I think I wish that our patients knew that their anesthesia providers care so much about them. I think a lot of times patients come in and they're so nervous and they think that we're just churning out the patients, that they don't realize that even though we only have a certain amount of time to bond with our patients and get to know them in pre-op, that we all really care about them and that their anesthesia providers want to tailor their anesthesia to the individual patient, and we really take that into account. So we like to do individualized anesthesia, and we just really care about you as a person, and we want to give you the safest and most competent care that we can.
And what do you love to do outside of medicine?
I am a horse girl through and through. So I love riding horses. I like training young horses. I like beekeeping and gardening. And I also like to do pretty much anything and everything that Montana has to offer, whether it's hiking, hunting, fishing, everything. I'm trying to do it.
And what's your favorite thing about Great Falls?
I would say that the people are 100% my favorite thing about Great Falls. Whenever I moved here 3 years ago, one of the first things I noticed was how wonderful the community is here. Everyone was so kind and welcoming and just really down to earth. So I love the people, and it's an honor to be able to care for them.
And what's your favorite thing about working here at Benefis?
My favorite thing about working at Benefis is really the community feel of it. And my favorite thing about being a CRNA is being able to give patients the best anesthesia experience possible. I love being able to tailor the anesthetic to the individual patient, and I love when a patient wakes up feeling happy and comfortable and surprised that their surgery's over.
Thank you so much for taking the time to speak with us.
You're welcome. My pleasure.